We have discussed two types of spondylitis. Whenever we talk about the cervical spondylitis, we need to understand three conditions. हमें तीन कंडीशन को समझना होगा. The condition one that is called spondylitis. Condition two called spondylosis. Condition three is called spondylolisthesis. So this is the initial stage, initial condition, initial problem. This is little advanced problem. And this is little, we can tell more advanced. This patient you can maybe cure sometime within 2 weeks or so. This patient might take 3 to 4 months. And this might take 7-8 months. So when the patient is coming with a neck pain, we can't fix, okay, we will cure you in 3 days or 12 days. But as soon as we apply our TCM protocol, even on the first day, patient will feel very good on the first day. पहले दिन ही उसे अच्छा लगेगा. कई बार तो पेशेंट पूछ सकता है तीसरे चौथे दिन, still I need to continue the treatment or not, because he will feeling very good. So you have to see the report of the patient, and you have to tell very clearly that you will take this much time as per your condition. So the first condition, that is cervical spondylitis. Spondylitis. The meaning of itis means inflammation. So there might be redness, there might be pain, there might be stiffness in the neck. गर्दन में दर्द होगा, पेन होगा, स्टिफनेस होगी. Right? And with the treatment, this will subside. Even person will be taking the painkiller, and person will feel temporary relief. Temporary means maybe relief for 1 month, relief for 2 months. Then it will come back again. So when the patient moving to the second stage, that is from spondylitis to spondylosis, जब patient दूसरी अवस्था में जाएगा, so what will happen? There will be a reduction of gap. इनके बीच का गैप कम हो जाएगा. There will be a reduced gap, which will create unwanted nerve pinching or compression. Right? There will be degeneration. Degeneration, because of the again and again they are coming in the contact in a not good way. So there will be degeneration. Maybe they will degenerate each other. Upper and the lower bone, any one bone और वन वर्टिब्रा माइट डिजनरेट, उसका वर्टिब्रा घिसने लगेगी. Now third thing, there is a formation of the sprouts or osteophytes. Osteophyte बनेंगे. Osteophyte means like BC sprouts, formation of sprout. So this is the second condition that is called spondylosis, which will take few months. ये कुछ समय लेगी. That is cervical spondylosis, like the lumbar spondylosis. So now the condition has reached from 1 to second phase. Now the third condition is happened rarely, means not with every patient. Most of the patient you will see in the second phase. In the third phase, what will happen? That is spondylolisthesis. So there will be definitely all the things like reduction of gap, yes, which will create compression. It will be there. Reduction of gap होगा, gap कम हो जाएगा दो वर्टिब्रा के बीच में. Number 2, degeneration will happen. Degeneration भी होगा. Number 3, osteophyte formation भी होगा. Osteophyte formation. So same thing will happen, plus there will be one more thing happen, which will make this problem very complicated, very critical. This vertebra either will go forward or backward little. This will move little forward, backward, changing the position, changing its own place. पहले ऐसा नहीं था, गैप कम हो रहा था लेकिन आगे पीछे नहीं जा रही थी. अभी आगे पीछे चली जाएगी. So it might go in the anterior side or the posterior side. Then we'll tell listhesis. If it is going to the anterior side, we are telling anterolisthesis. If it is going on the posterior side, we are telling posterolisthesis. Now, this is a very critical condition. Please never commit any patient that you will cure within 2 days, 3 days, 1 week. स्पॉन्डिलोलिस्थेसिस पेशेंट को आप ये कमिटमेंट मत करिए कि आप उसे 7 दिन में ठीक कर दोगे. आप दर्द कम कर दोगे लेकिन दर्द वापस आएगा, फिर पेशेंट आपको ही परेशान करेगा. Now, treatment for all types of the spondylosis will remain same, what we discussed. So we have discussed the treatment as per our yes type or the no type. The person is having cervical spondylosis, cervical spondylitis, or losis or listhesis, anything. So we have discussed the yes type and the no type. Okay. So treatment will remain same whether the spondylitis or the spondylosis or the spondylolisthesis or the any other problem like the disc herniation, disc bulge. The treatment remains same. We need to find out whether the person is having problem. While doing yes, then this protocol will be applicable, or the person is having problem while telling no, then this protocol will be applicable. So we already have discussed this yesterday. Now let's proceed to the next treatment part. So the person suffering with a low blood pressure and the person suffering with a high blood pressure, there will be different formula. अगर एक व्यक्ति को लो बीपी है, एक अलग फॉर्मूला होगा, और हाई बीपी एक अलग फॉर्मूला होगा. It's a very wonderful. You are not only treating the cervical spondylosis, but you are also working on the low BP. Working on the low BP in a way कि you are working on the root problem which is creating low BP. उसके अंदर की वो कमजोरी जिसके कारण उसे लो बीपी हो रहा है। हो सकता है कि कुछ कमजोरी हो, ब्लड की कमी हो। द पर्सन माइट बी सफरिंग विद ब्लड डेफिशिएंसी, kidney deficiency, kidney yin deficiency, kidney chi deficiency. You are not only working for the low BP, but you are also working for the root problem. So a person coming with a low BP and the person coming with a high BP with the neck pain treatment will be different. Let's think about the low BP first. पहले हम low BP की बात करते हैं. So cervical spondylosis with the low blood pressure, the normal blood pressure is 120 by 80 millimeter of mercury. If this blood pressure is going 110 by 70 millimeter of mercury, we can consider normal. There is no issue. इसे हम normal consider कर सकते हैं. But when the blood pressure is going further down like 100, 70 or 100, 60 or the 90, 70, 90, 60 millimeter of mercury, then we will consider it as a low BP. Now this person is suffering with a neck pain or the cervical spondylitis, cervical spondylosis, then we will be working like this. In the extraordinary vessels, small intestine 3 is very effective for the neck pain. ये बहुत प्रभावकारी है neck pain के लिए, right? So now SI3 is the master point of governing vessel, is the master point of governing vessel. So when the person is suffering with a low BP, we will tonify the SI3. SI3 one of the great for improving the blood pressure, right? So there are 2 points SI3 on the upper side, urinary bladder 62 on the lower side. So upper point will increase the BP if you tonify or even you stimulate. ये ऊपर का point BP बढ़ाता है. So shortly we will discuss if you want to increase blood pressure, then tonify SI3 and sedate UV62. So SI3 tonification will be tonifying the governing vessel and will improve the blood pressure. On the other side, if you want to reduce the BP, BP, अगर आपको BP को कम करना है तो उल्टा करना पड़ेगा. You need to sedate UV, you need to tonify UV60 and sedate SI3. Generally, in the extraordinary vessels, we are having 4 point on the upper side, 4 point on the lower side, like SI3 on the upper side, triple warmer on the upper side, pericardium 6 on the upper side, and lung 7 on the upper side. ये सारे पॉइंट ऊपर होते हैं, हाथों में होते हैं. These are in the hands. And some point in the leg, feet, like urinary bladder 62 on the feet, gallbladder 41 on the feet, spleen 4 on the feet, and the kidney 6 on the feet. Right? If you are tonifying these points, they will increase blood pressure. ये blood pressure को increase करेंगे. But if you tonify these points, they will reduce blood pressure. ये ऊर्जा को बढ़ा देंगे. They will improve the chi and they will reduce the chi. They will balance the chi. That's why we will shortly discuss UV62 we are using. If someone is having excessive chi in the head region, in the brain region, like epileptic fits, stroke, something unwanted, very excessive, we will work on the UV62. In the same way, all the points on the lower side will reduce the blood pressure. Sometimes this formula just not applicable on the lung 7, we will see that. So coming back here. Now, male patient, we know the left side is the dominant side for male. So now we are starting the treatment. This patient is needing the treatment for neck pain, but having low BP, SI3 tonification, UV62 sedation. Then kidney 3 tone bilateral, kidney 3 is the point, which is a very excellent point to improve kidney, to improve bones. किडनी 3 हमारे किडनी को इम्प्रूव करने के लिए, बोन को इम्प्रूव करने के लिए बहुत ही बेहतरीन पॉइंट है. And the governing vessel 3 is the point, local point. We will sedate. If you are putting in the sujog, then we'll sedate bilateral. So this is our protocol for the male patient. ये male patient के लिए हमारा protocol होगा, right? So let's see here. If we look at the SI3, we already have discussed SI3 location here. We already have discussed the location of UV62 in the feet, that we already know now. In the level 1, we have discussed all the location. You can put in the sujog also SI3, right? And UV62. आप सुजोग में भी लगा सकते हो. You can put the kidney 3 in the sujog or in the body, and governing vessel 3. Governing vessel 3 point is very much important. I want to highlight this point. Governing vessel 3. Governing vessel 3 को कहते हैं the yang gate of lumbar vertebra. हमारे लंबर वर्टिब्रा का यांग का दरवाजा, जहां से यांग एनर्जी निकलती है. I will show you this point. So when we are stimulating this point, जब भी हम इस पॉइंट को स्टिमुलेट करते हैं तो क्या होता है? Look at this first. So this is the DU3. ये हमारा DU3 है. अगर आप एक व्यक्ति को उल्टा लिटा दो पेट के बल और उसके कमर पर एक पानी की बूंद डाल दो, तो जहां जाके पानी की बूंद ठहरेगी वही DU3 है. यानी सबसे गहरा भाग, the most depressive part of the lower back. So it's very easy to find out. It's below, near about below lumbar 4 vertebra, DU3. This is called yang gate of lumbar vertebra. When you are stimulating the DU3, जब आप DU3 को stimulate करते हो तो yang ऊर्जा पैरों में जाना चालू हो जाती है. Yang energy start flowing in the legs. Someone is having swelling in the leg, someone is having pain in the leg, someone is having some weakness in the leg, not able to walk properly. yang deficiency in the leg, lack of energy in the leg, put the point in the DU3, energy will start flowing in the lower part. This is something like a gate. जैसे you are opening the gate of dam, water will start flowing. आपने डैम के दरवाजे खोल दिए तो पानी निकलना चालू हो जाता है। ठीक उसी प्रकार से आप जब DU3 को स्टिमुलेट करते हो तो पैरों में ऊर्जा का प्रवाह चालू हो जाता है। As soon as you put the DU3 point, there is energy flow start in the legs. You have to sedate this point to open it. Sedate. Sedation means you want to remove, you are thinking to remove some blockage from this part. Even many persons suffering with the knee pain because of lumbar vertebrae compression, nerve compression in the lumbar vertebra. If the person is suffering with the knee pain, we know that knee pain. So knee pain in the medial side because of lumbar 3, knee pain in the front side because of lumbar 4, knee pain in the lateral side because of lumbar 5, and knee pain on the back side because of S1, lumbar 3, lumbar 4, lumbar 5, and S1. So even the lumbar vertebral compression can create the knee pain. Person is asking you, can you treat the knee pain? Even person are doing knee replacement, but problem was compression of the nerve in the lumbar spine. So governing vessel 3 located just below lumbar 4 vertebra, हमारी lumbar 4 vertebra के नीचे पाया जाता है। आप इसे लोकेट कर सकते हैं ठीक से। और दूसरा तरीका है लोकेट करने का, ये तरीका, you keep the hand like that, feel the iliac crest, this is the upper border of the bone, this upper border of the bone or the iliac crest, this is the iliac crest, we can feel the bone. Now from this level, if you go exactly on the back side, that is lumbar 4 vertebra. Point below that, that is DO3. So in our protocol, we have 2 extra point, kidney 3 and DO3, 3. With the help of this protocol, we will able to work for the lower back pain, which is happening with the male patient having low blood pressure. So cervical spondylosis with the low BP in the male, SI3 tonification on the left side, SI3 tonification on the left, UV62 sedation on the right, kidney 3 bilateral tonification, and governing vessel 3. If you are putting the sujug, then bilateral sedation, or you are putting in the body, then single sedation. So this is for the male patient. Now female patient, this will be little different. फीमेल पेशेंट के लिए अलग होगा, मैं इसकी भी बात करूंगा अभी, ग्रुप 2 की आई विल टॉक टू यू शॉर्टली. So this was the group 1 treatment for the patient suffering with the cervical spondylosis. Now let's talk about the female patient. अब हम female patient की बात करते हैं. In the female patient, we will start the treatment the same way, but for the female we know the right side is the dominant side. Female में right side dominant होती है. So we'll start the treatment, SI3 tonification on the right, urinary bladder 62 sedation on the left. So we'll start the treatment from here because the female is suffering with the low BP as well. Even you can ask what about the patient having normal BP? ऐसे patient के लिए हम क्या करें जिसका BP low नहीं है, normal है? Even we can apply this. protocol. If the patient is having absolutely normal BP but without medicine, मेडिसिन से जो बीपी कंट्रोल में किया गया है उसे हम बीपी की कैटेगरी में रखते हैं. The person is not taking any medications and is still either the BP low or the normal. Even the normal patient, we can treat this. Now, for the female patient, SI3 tonification and the UV62 sedation, but in the female body, there is a very important part. Can you tell me which is the important part in the female body? Most important part in the female body, which is affecting neck, which is affecting lower back, which is affecting knee, which is affecting their moods, which is the most effective part in the female? That is uterus. Uterus is the very and most effective part in the female. If there is a disharmony in the uterus, the female might suffer with the neck pain, with the shoulder pain, with a headache, with a migraine, with the lower back pain, with the knee pain. There are many problems. So we have to balance the uterus also in the female. हमें female का uterus balance करना होगा. For that, we are taking lung 7 and kidney 6. तो इसके लिए हम ले रहे हैं lung 7 and the kidney 6. Why the lung 7? Now you already know why the lung 7. Because lung 7 is the master point of Ranmai. लंग 7 हमारे रैनमाई का मास्टर पॉइंट है और रैनमाई का मतलब है द मीनिंग ऑफ रैनमाई CV1, CV2, CV3 to CV24 entire front part which is covering chest, which is covering stomach area, which is covering uterus area. Rhenmai. Lung 7 is the master point of Rhenmai. So now there will be अब हम सर्किट बनाएंगे फीमेल्स के लिए. हाउ टू मेक द सर्किट? SI3 tonification on the right, urinary blood 62 sedation on the left. Now lung 7 tonification on the left and kidney 6 sedation on the right. So this is the circuit formation. In the female, SI3 and UV62 will be working on the cervical spine, and lung 7 and kidney 6 also working in the central core, starting from the uterus. So for the female, it's mandatory to put these 2 points. Female के लिए हमें uterus का point लगाना होगा. If you apply this protocol is very much effective not only for the cervical spine but for entire spine in the female. Whether upper spine, middle spine, lower spine, this protocol is working very nicely. And we can see the immediate effect in the pain. Especially right now we are discussing about the cervical spine and governing vessel 3 sedation bilateral. So again we are opening the lumbar gate. तो ये हमने प्रोटोकॉल्स लगाया. Now we are thinking for group 2. अब हम group 2 की बात करते हैं. Group 2. Sometimes pain is not exactly on the back side. कभी कभी पेन हमारा थोड़ा साइड में होगा, neck pain. If the pain exactly not in the back side, but it is in the lateral side, then we'll go with the TW5 and the gallbladder 41. तब हम TW5 और gallbladder 41 पर जाएंगे. If pain is not exactly on the back means SI3 UV62, side triple bomb 5 and the gallbladder 41 थोड़ा सा साइड में है तो हमारा ट्रिपल वार्मर और gallbladder का एरिया चालू हो गया. So again here, if the female or the male patient suffering with the low blood pressure with the neck pain, this neck pain is a little on the side. So we will, with the low blood pressure patient, we will work triple warmer tonification and gallbladder 41 sedation for the male. Even you will apply this triple warmer tonification, triple warmer 5 tonification, you will see the low BP now becoming normal. I have applied this protocol for many patients. One patient suffering with a low BP, neck pain, occipital headache. Low BP and headache here, occipital headache, and which is also coming on the head region, on the side. We can see the quick result with a triple bomb 5 and gallbladder 41, 2 points. Only 2 points enough. So in this way, for the female patient also, we will apply the same formula. But for the female patient, the right side will become the dominant side. So here, the triple pump of 5 tonification on the right side and gallbladder 41. For the female, triple pump of 5 will go on the right side. And for the male, triple pump of 5 will go on the left side. Only this is the difference. So this was for low blood pressure. Let's move to the high blood pressure. अब हम high blood pressure की बात करते हैं. Now this formula is very, very effective for the patient suffering with high BP. By applying this formula, we can work on the high BP if there is unwanted high energy in the head region. Many times we have seen due to the high BP, person is having neck pain, sometimes also getting stroke. As soon as we apply this formula, quickly we can calm down the blood pressure. हम blood pressure को quickly ठीक कर सकते हैं. Now you can see, now we are doing urinary bladder 62 tonification on the left side for male because left is the dominant side for the male, and SI3 sedation. Now you can see we are sedating the SI3. UV62 tonification and SI3 sedation, just reverse formula. As soon as we apply this, we will see quick fix of the BP. Person is coming with a neck pain or the cervical spondylosis, spondylitis. So remaining point will remain same, K3, tone bilateral, and governing vessel 3, sedate bilateral. ये हमारा फॉर्मूला हमने जैसे ही लगाया, हम देखेंगे कि बीपी काम डाउन हो गया, ब्लड प्रेशर इज कमिंग डाउन. सेम फॉर द फीमेल. फीमेल के लिए भी वही है, कुछ परिवर्तन नहीं है, सेम थिंग. But in the female, we are applying the same thing here. Now you can see here for the female. Female, the right side is the dominant side for female. Female के लिए right side dominant side होती है. So for the female patient suffering with a high blood pressure, we will apply this formula. We will treat the neck pain as well as will fix the high BP quickly. Within 10 minutes, you can see BP is normal. So how to apply the formula? For the female, we know the right side is the dominant side. So we'll tonify the master point, that is urinary bladder 62. We'll sedate the couple point, that is SI3. Sedate. This is the couple point. Right. Again, we will be focusing on the uterus in the female. So we will tonify the lung 7 on the right side. Lung 7 always will be on the, like in the previously we have also seen the lung 7 was tonified. Lung 7 को हमने tonify किया था. अभी भी हम lung 7 को tonify कर रहे हैं. So we are making the circuit in the way that one side will be SI3, other side will be lung 7. So lung 7 tonification on the right side and kidney 6 sedation on the left. So lung 7 we will be taking on the other side of the SI3. जहां पर हम SI3 लेंगे, उसके दूसरी ओर हम lung 7 को लेंगे. So SI3 and UV62, this will work on the spine, and lung 7 and kidney, this will work on the central core starting from the uterus. Then governing vessel 3, sedation bilateral. Very, very effective formula. We can see quick result in the cervical spondylosis with the high blood pressure. So we have seen this protocol for the male and female. Now again, the high BP, neck pain, but now neck pain is happening little on the side. अभी गर्दन का दर्द थोड़ा साइड में है. So apply the formula gallbladder 41 tonification. Now we'll apply the little change formula. अब हम for the male patient, the left side is the dominant side for male. So gallbladder 41 tone and triple Gorman 5 sedate. As soon as we do the triple 5 sedation, we will see quick result. So gallbladder 41 tone on the left, triple Gorman 5 sedation on the right. This for the male, and for the female, right side is the dominant side. So gallbladder 41 tone and the triple Gorman 5 sedate. Right and left. Remember one thing about the gallbladder 41. Gallbladder 41 के बारे में बात ध्यान रखना कि इसकी लोकेशन सही होना जरूरी है. अगर गॉलब्लैडर 41 की लोकेशन सही नहीं हुई तो दर्द उल्टा बढ़ सकता है. Because I have this experience. Once I was in the hurry, so I applied the gallbladder 41 in the wrong position. Even just a magnet, not the needle also, in the feet. Patient told, I'm feeling more headache. Then I removed the gallbladder 41 and just applied 2-3 millimeter up. Immediately patient got very good benefit. So there are two groups. The group SI3 UB62, group 2 lung 7 kidney 6. In this grouping, there is a sequence of the point also that I will tell you. ये हमारे point का sequence भी होता है कि पहले लगाते हैं master point SI3. Then we are putting all the other point, all the different point. In the last, we are putting urinary bladder 62. Don't do like this, SI3, UB62, then the remaining point. No. SI3 will be the first point. Urinary bladder 62 will be the last point. All the point will be in the between. Okay, सारे point बीच में होंगे. And when you are removing the points, remove in the reverse order. जब आप point को निकालोगे तो reverse order में निकालोगे. Sometimes it becomes little difficult because we are telling patient to remove or we are telling our therapist to remove. तो वो इतना reverse order में ना भी निकालें. But if you can, then you follow it. Otherwise, put the point in the sequence. So enough for today. Now we'll continue the session tomorrow. अब हम कल discussion करेंगे. Fine. Let's close the session. Recording will be given shortly. Closing now.